This show is part of the Recovered Life Network. Check us out at recoveredlife.tv.
For decades, the standard medical response to managing serious mental illnesses like schizophrenia and bipolar I disorder has centered almost exclusively on psychotropic medications. While antipsychotics and mood stabilizers are essential for controlling acute psychotic episodes, they often come at a heavy cost. Patients frequently endure severe metabolic side effects, including massive weight gain, insulin resistance, and prediabetes, while remaining burdened by persistent cognitive deficits and debilitating depressive symptoms that current drugs simply cannot fix. But according to a groundbreaking clinical report published by the Brain and Behavior Research Foundation, an entirely new frontier known as metabolic psychiatry is offering profound new hope. Researchers have delivered the peer-reviewed results of the first-ever randomized controlled trial evaluating a medical ketogenic diet for individuals with schizophrenia-spectrum and bipolar disorders. The trial, led by BBRF grantees and clinical researchers at UCSF, evaluated outpatients placed on a therapeutic ketogenic diet consisting of high fats, moderate protein, and ultra-low carbohydrates. Skeptics in the psychiatric community have long argued that complex, restrictive diets are too difficult for individuals living with severe mental illness to sustain. However, the study shattered those assumptions, demonstrating high patient feasibility and excellent adherence over a 4-month period. In the initial 1-month randomized phase, participants on the ketogenic diet demonstrated rapid, statistically significant improvements in key metabolic markers, such as reduced insulin resistance and lower blood glucose levels, compared to those on their usual diet. While 1 month was enough to correct underlying metabolic health, the true psychological breakthrough unfolded over time. Participants who completed the 4-month ketogenic extension experienced widespread, statistically significant improvements across all primary clinical measures. They recorded major reductions in symptoms of depression and psychosis, alongside marked enhancements in daily cognitive functioning. Crucially, blood data proved that these mental health gains were directly driven by the presence of circulating ketone bodies in the bloodstream, not simply weight loss. By supplying the brain with ketones, the diet bypasses defective glucose processing engines in the brain, restoring cellular energy balance and dampening underlying neuroinflammation. Ultimately, this milestone study marks a monumental shift in how we understand and treat severe mental illness. It proves that the brain and the body's metabolic systems are intimately, indivisibly linked. Rather than viewing psychiatric conditions as purely chemical imbalances isolated in the mind, metabolic psychiatry treats them as systemic energy crises that can be directly supported through targeted nutrition. As larger clinical trials continue to expand on these findings, ketogenic therapy is poised to become a powerful, evidence-based tool alongside standard care, empowering patients to reclaim their metabolic health, clear cognitive fog, and achieve sustainable emotional stability. This vital medical research was originally featured by the Brain and Behavior Research Foundation.